On this episode of Connections Cleveland, we tackle one of the oldest enemies known to man. Nearly 1 out of 3 people in the U.S. will have cancer during their lifetime. Cancer can happen at any age. People of any race and ethnicity can get cancer. In spite of so many people being affected by cancer, not many people understand what it really is. Cancer cells get into the bloodstream and can travel to other parts of the body. There will remain the cancer cells traveling in the blood. Some of the cells stop in the lung, some stop in the liver. And once the cells are in the lungs and the liver, the cancer starts to grow. We spoke with radiation oncologist William D. Mass to give us a deeper understanding of what cancer is and what it does to the body.
Well, in general, cancer, simply put, is an abnormal growth of cells. So in our body, when we have a cell, as cells grow together and they get in contact with each other, they speak to each other. And by speaking to each other, they are able to control their growth. This is a concept called contact inhibition. When cells lose this ability to speak to each other, as we call it, contact inhibition, they then can grow without any type of control. And basically, that's what cancer is, an abnormality of growth that has no checkpoints or no contact inhibition, so it's abnormal growth of cells. So cancer is a very broad spectrum. Okay, we tend to divide it by organ systems, so cancers of the brain, cancers of the breast, cancers of the lung, cancers of the blood system. For example, in the blood system, you have lymphomas and leukemias. So with lymphomas, these are cells that modulate the immune system of your body. And when they get out of that control, they can grow and develop. So in our body, we have certain organs called lymph glands or lymph nodes. And with lymphomas, these lymph glands or lymph nodes tend to become enlarged. So for example, one may feel an enlargement in the neck, one may see an enlargement under the arm, one may see an enlargement in the groin. So with lymphomas, these are usually the first signs that something may occur. Depending on how fast these things grow and the location, they may also present certain symptoms. So normally in a groin area, you may not be too concerned about pain, or under the armpit, you may not be concerned about pain, but as it grows, then it becomes somewhat of a concern, and it can then begin to cause pain. So pain typically is a side effect or one of the presenting symptoms of a lymphoma. In other systems, it would depend on where the cancer was. So in the brain, you may have a seizure. In the lung, you may be coughing up blood or have difficulty breathing. You know, in the GI tract, like your colon or your rectal area, you may see blood in the stools. So the signs and symptoms depends on where that cancer may be starting from. So let's say, for example, you talked about lymphoma. Okay, so patient presents with an enlarging mass or a tumor, as you would call it. The first step to establish a diagnosis is typically to run some blood tests and get a biopsy. Now, a biopsy is obtaining tissue from that abnormal mass, and that's usually done by a surgeon. A surgeon will get some tissue from that mass, and that will then be sent to a pathologist. The pathologist is the expert that looks at these cells and determines if they are abnormal and what type of abnormality is involved. Once the pathologist makes that diagnosis, the patient then is typically referred to an oncologist, either a medical oncologist or a radiation oncologist. The next step in the process is to determine the extent of the cancer, which is called staging. Typically in cancers, we have 4 stages. Stage 4 is typically the most advanced and usually is considered incurable. The first 3 stages are usually when the cancer is within the region where it started, but may not have spread outside of that area. So typical tests that would be done to determine the extent of the cancer would be, of course, a complete physical examination. Blood tests would be done. Certain types of imaging studies, such as X-rays, CAT scans, PET scans, or MRIs, would then be done. And depending on the results of these tests and physical examination, will determine what the stage of the cancer is.